My family and I were very deeply affected by the impact of the mental health epidemic, especially with my youngest brother Kevin. He died 20 years ago this month, which was just before his 26th birthday. When I went into the practice of mental health, what I was really concerned about is that anyone who came into my sphere of care would get the kind of help that I felt that my family and I and Kevin needed when we were at a point of crisis. And that philosophy really filtered through the hospital group that I co-founded and built up from one hospital of 50 beds into a hospital group of about 13 sites with just under 1,000 beds. We were treating 800 patients a day and about 22,000 patients a year. And what I've always been absolutely fascinated by is how do you scale that approach? How do you make sure that every single person that comes into your ambit of care gets the kind of help that I would have liked for me and my family and for Kevin when he was in such severe distress?
I love technology, and I love technology's ability to transform an industry. And I was fortunate to join Uber early, and I saw firsthand the ability that technology has to really transform a sector for the better. When I was introduced to Alan, I knew that this was the next opportunity, that we could make an impact together, combining our very different backgrounds, but a common passion to try and change the way people think about mental health care. The current mental health system is breaking at the seams. It can't possibly absorb the need for care that we have today with only enough mental health professionals to serve 6% of the US population. We're just not going to solve the crisis trying to apply traditional approaches to the same old problem that is getting worse all the time. We no longer want stigma or cost to be a barrier to access. We need to change the way we think about the crisis. We need to introduce new technologies. We need to help people earlier on and not just wait for that moment of distress. And that's exactly what we're doing at Panda. We want you to invest proactively in your mental health care. We want you to find community. We want you to invest in mental fitness in the way you do your physical fitness. We're really tired of people talking about solutions with no action. It's time for us to stand up and get involved. And today, we're making a commitment to offer 24 hours of live interactive sessions every day in America through Panda Health to everyone completely for free. Join us and help us solve this crisis.